One of the most important things that healthcare systems can do to be more trustworthy is to focus on access and continuity. So many of our patients struggle to get access to care, and so many of our patients don't have continuity with the same physician in that specialty. And yet, it's through that relationship, that's where trust is born. And that's where we are better doctors, when we know our patients well. In my practice of 32 years in Iowa, we had continuity within our team. I worked with the same nurses, some of them for over 20 years. And that allowed us to have trust in each other, which I think allowed us to provide better care than we would have otherwise to our patients.
I think the most important thing to be trustworthy in today's environment is to tell the truth. Any attempt to wash over uncomfortable messages is going to be a mistake. I think that a lot of that has to do with trusting the public, trusting patients, trusting families, and just tell the truth. Then engage in authentic dialogue. That builds trust. Some of the best examples I've seen of building trust through truth-telling has to do with patient safety. When something goes wrong in a hospital or in medical care, to actually disclose and come forward to patients and families and say something went wrong. There's your loved one or you have been injured, and let's talk about it. We apologize. I apologize. We want to make you whole. We'll do everything we can to make sure that this doesn't happen again to anyone. Patients appreciate it, and it builds trust instead of destroying it.
I think what healthcare organizations can do to be perceived as more trustworthy than currently is to do what healthcare practitioners do, which is to say that they need to develop that relationship with the patient, the public, if you will, writ large for the organization, so that there is an understanding of their consistent focus on evidence-based practice of medicine and ultimately the truth. And I think that's what's critical, especially at a time when there's so much doubt about everything from medicine to science.
To gain trustworthiness in today's environment, I think it's really important to center the conversation in the fact that we're even talking about trust and trustworthiness. With that said, I think one of the most important things that can be done as we learn about and continue to evolve our understanding of trust and trustworthiness is to look back in the past, to understand where we have been, to understand the failures that have happened, and to help everybody find the health information that they need to make the right decisions for themselves, their families, as well as their communities.